The coronavirus that we're experiencing now is one of 7 that infect humans. In the last 2 decades, we've seen emerge 3 very important coronaviruses that infect humans and cause substantial disease. That has been SARS, MERS, and now this novel coronavirus. They're all basically the same kind of virus with different genetic material that has different effects on humans. If I sort of put it into perspective for other viruses that people would be familiar with, it is, of course, different from influenza. It is not infecting as many people as, say, an influenza virus would. It's a different R0 or reproductive number. The case fatality rate appears to be in that 2 to 4% range. By comparison, influenza is about 0.02. SARS was about 10%. MERS was about 35%. Ebola about 60%. So that kind of helps to put it into perspective. How transmissible is this virus, and what is the incubation period? The best guess is it appears to be somewhere between the 3 days to 7 days, maybe as long as 10, but somewhere in that neighborhood. The value of a surgical mask is a couple of fold. One, if I'm infected and I cough, I prevent those large respiratory droplets from being expelled into the air. It doesn't stop aerosolized virus, and that's a key limitation of those masks. The other thing it does is it serves as a reminder to not put my fingers into my nose, eyes, or mouth, not cough, directly into my hand and then touch something or somebody else. The next level of protection is what we would call an N95 mask. These have to be fitted properly to the individual. That does stop aerosolized virus. And of course, we would use gloves and wear the proper protective clothing and eye shields or a face mask. Those are the things that we would do in a hospital, for example, if we were taking care of somebody that we thought had coronavirus. The other thing is what we call social distancing. So staying away from people who are ill, or if you're ill, staying at home, not going to school or work or to the mall. The other thing is very frequent hand washing. If you touch something outside your home, or you shake hands with somebody who's been ill, or you're touching, think of the things we touch: doorknobs, keyboards, telephones. It goes on and on. Wash your hands frequently. Keep your hands off your face and eyes, nose, and mouth. The average person is touching that anywhere from 5 to 15 times a minute. So that's a lot of exposure. And those are really key things to be doing. I think in the short term, it's going to be the respiratory protective measures and antivirals that we talked about are the answer. The mid to long-term answer is going to be antivirals and vaccines. The good news with antivirals is that we have developed antivirals for HIV that are very effective, for Ebola virus that look to be effective, and for which preliminary data suggests that they're going to be useful in coronavirus infection. So that's really the big scramble right now, is doing clinical trials right as, kind of building the plane as we're flying it, to see if these antivirals will be helpful in this current coronavirus situation. This is a rapidly evolving situation. There is a lot unknown, but the world's scientists and public health officials are focused on this. I feel that we are very prepared here in the U.S. Our CDC, our Health and Human Services, our scientists have done a superb job of protecting the U.S. When you look at the incredible amount of international travel, and you look at how quickly preparations were put into place here in the U.S. with screening, with quarantine of anybody, of diagnostic assays to determine if somebody's ill or not, in just the kind of shoe leather epidemiology, as we would call it, of tracking contacts, we have done very well with no second generation cases in the U.S. Let's not panic here. Let's focus our attention. Let's be thoughtful. Let's be intentional in this. But this is nowhere near the outbreak that influenza right now in the United States is. So I don't want people to panic. That does not help us. There's going to be lots of respiratory, and there is lots of respiratory illness in the U.S. It's when it becomes complicated with shortness of breath and pneumonia or exposure to people where there's a high likelihood that they have this novel coronavirus that we become concerned. But I will say in the U.S., and I have not necessarily said this in the past with outbreaks, I think we've learned a lot of lessons and we are incredibly well prepared.